have joined us on Starting Up. Now, only a few sectors offer the kind of opportunity that the Indian healthcare space does. In fact, low-cost healthcare is a crying need here for the country. Well, a bunch of startups have decided to put on their stethoscopes and try and address that need. So the ECL explores the trend.
From ambulances to maternity to low-cost medical treatment, startups have taken multiple paths to capitalize on the big healthcare opportunity. An enormous opportunity which was spotted by the Vatsalya team back in 2004, one which they decided to capitalize upon after testing multiple models.
We spent the first 2 years trying to set up various types of models. We set up a clinic, we set up a hospital, we set up preventive, primary, secondary, different models, and use the time to understand what works from a customer's perspective, from investor's perspective, and then came up with this model which says that we are going to set up hospitals which are about 70 beds in size and can cater to about 60 to 70% of the local community needs.
The final 4 verticals they decided to focus on: maternity, pediatrics, surgery and medicine. All of which at a cost which is 1/4 of that in an urban area. Vatsalya today has 11 hospitals across the country, each of which takes an average of 2 years to break even. The other big opportunity is in emergency care, a space which Shweta Mangal of Ziqitza Health Care has capitalized upon with 285 ambulances across the states of Kerala, Bihar, Rajasthan and Maharashtra.
From Jaslok Hospital to Andheri residence.
Yes, a call is taken, the nearest ambulance is identified using GPS, and within minutes it makes its way to the patient. Most ambulances are advanced life support, which means it can deal with any emergency ranging from a road accident to a cardiac arrest. Dial 1298's business model is akin to that of a medical taxi. They charge a fixed amount per kilometer travelled regardless of the treatment given. Out of their 285 ambulances, 229 are managed in partnership with state governments through public-private partnership models. Models which have worked very well for Ziqitza.
In a typical PPP, the capex is really borne by the government. It's really the opex for which the operators bid for. We get a compensation from the government. The service is free for the user, the end user, or is heavily subsidized, and that helps us achieve our social objective of reaching out to each and every Indian who's out there in the rural sector.
Another startup growing at a rapid rate is LifeSpring, based out of Hyderabad. With a clear focus on maternity care, LifeSpring has set up 9 hospitals in the state of Andhra Pradesh. With a cost of 2,000 rupees per delivery, the key clearly is on keeping costs low, something they've achieved through a clear strategy.
All our hospitals are not greenfield hospitals, they are in fact the brownfield hospitals. We have taken the buildings on long-term lease, and then our doctors are also full-time doctors. They don't get paid for case-wise basis, and we take the opportunity of this economies of scale.
The Acumen-funded LifeSpring plans to expand to 200 maternity hospitals over the next 5 years. The projections for the sector are as ambitious. Currently, the sector is pegged at $18 billion, with 30% of the revenues coming from the rural sector. Over the next 3 years, estimates expect this to grow to $30 billion, with the revenues being split 50-50 between the urban and rural areas. Someone who's been keeping a close watch on the sector is Madhukar Sinha of venture capital firm Avishkar.
That will wrap up this week's episode of Starting Up. But hey, we may have a brand new look, but what hasn't changed is our dedication to the startup community. If you're a founder of a startup and would like to be featured here on the show, write into us on startingup@etnow.tv. With that, we'll say goodbye, but before we go, as we say every week, remember there's never a better time than now to go out there and start up.